I'm Dr. Karen Anderson. I'm a neuropsychiatrist at Georgetown University in Washington, D.C., and I'm the director there of the Huntington's Disease Care, Education, and Research Center, which is a Huntington's Disease Society of America Center of Excellence. Huntington's disease is a rare disease. We think about 41,000 people in the US have a diagnosis of Huntington's disease, but there are probably another 200,000 who are at risk for Huntington's disease. It's autosomal dominant, so that means that anyone who has a parent with Huntington's disease, if they're a biological child of that parent, they have a 50% risk of getting Huntington's disease at some point in their life. We do have a gene test that we can do for Huntington's disease that will predict whether someone has the expansion that causes the disease, but it doesn't tell us very accurately when someone's going to start to have symptoms. The common symptoms of Huntington's disease include chorea, dystonia, balance impairment, cognitive impairment, including executive dysfunction, which can be very prominent early in the disease, and also many psychiatric symptoms, including depression, apathy, suicidal thinking, aggression, and irritability. Huntington's patients do tend to have chorea. If you look at adult Huntington's patients, about 90% of them have chorea. It often starts in the extremities, so in the fingers and toes, with subtle shifting movements. Patients may look like they're anxious or uncomfortable. And then it can progress to involve the face and the trunk. It can be very disabling. Patients tend to drop things. They sometimes fall from chorea. When the movements become really problematic, they may end up inadvertently hitting people who are trying to assist them with dressing, eating, or bathing. And certainly it makes other people uncomfortable. So when patients go out in public and have chorea, they're often pointed at, noticed, and sometimes, unfortunately, even mocked. So suppressing chorea can address a lot of these issues. It can help patients function better in the world, and it can make activities of daily living much easier for patients and caregivers. Austedo is a drug that was developed to deplete dopamine. We know, looking at different hyperkinetic movement disorders, including chorea in HD, that when you decrease dopamine, this causes a decrease in the fast movements like chorea. So Austedo is what's called a VMAT2 inhibitor, or a vesicular monoamine transport inhibitor that, again, decreases dopamine. It's based on an older drug called tetrabenazine, but what we did is the company Teva replaced the hydrogen with deuterium, and this caused a strengthening of the chemical bonds so that the drug is metabolized much more slowly, which decreased side effects that one might see from tetrabenazine to deutetrabenazine or Austedo. I was involved as one of the principal investigators on behalf of Teva for the study. This was a real-world setting, which is why I'm so excited about the study, because we really looked at what happened with real-world patients and their experience using a kit to assist them in getting to the optimal dose of Austedo. So this was a phase 4 study, and it looked at a 4-week titration kit to help patients get to the optimal dose of Austedo. One of the things that I do notice in my own practice is that patients often come to me and they've tried a drug like Austedo for chorea, and they find that they don't get a good response. The practitioner will say, failed VMAT2 inhibitor, which is this class of drugs. Often the problem is patients are underdosed. If someone's not a specialist in Huntington's disease, there just may not be a lot of experience using the drug. There may be reluctance to push the dose up a little bit higher. A titration kit is nice because it gives guidance to the patient and clinician as to how they are going to proceed in titrating the drug. It gives them a sense of the dose. So with a drug like Austedo, where you can really individualize and optimize the dose, it's nice to have a titration kit to get you started and get you along track to the correct dose. We had 17 patients enrolled with Huntington's disease in the study, and we found that 76% successfully completed the titration kit, and they had more than 90% adherence. They had a reduction in the total Chorea score of about 4.4 points, which was a 33% reduction from Chorea at the start of the study at baseline. About 53% achieved treatment success on the clinician global impression of change, and 71% on the patient global impression of change. When we looked at satisfaction with the kit, 100% of the patients who completed the satisfaction survey found it useful, and 100% of the providers who completed the survey also found that a kit was very useful. But overall, the drug was really well tolerated by these patients in a real-world setting. There were a couple of patients who had treatment-related AEs. One patient had somnolence. One patient had somnolence, fatigue, and also insomnia, but overall the patients did very well with the drug. And again, it really enabled them to get to an optimal dose where they found suppression of chorea. It really demonstrates that if you give people help in getting to an optimized, personalized dose of Austedo, they're going to do well with the drug. Again, it really speaks to how we can correct this problem of underdosing that we see with some providers who are maybe not familiar with prescribing Austedo. And it also shows that in a real-world setting outside of a clinical trial, patients get benefit from Austedo in terms of suppressing or decreasing their chorea.